Dirty little secret in hospitals: medication stolen from patients who need it.
A national conference in Cincinnati aimed to shine a spotlight on this problem and come up with some answers. Local 12's Megan Mongello talked with a woman who was a victim.
Lauren Lollini is healthy today, but back in 2009 she was living in Denver and fighting to stay alive. Her battle made national headlines. A surgical tech wanting drugs stole Lauren's pain medication for herself.
So let's say it was in a drawer that wasn't locked, or it was under a towel on a surgical tray. It was very easy for her to take that syringe and use it for her own, and then take that syringe and fill it with saline so it looked like it had the fentanyl in it, and then replace it onto another surgical tray.
Lauren was one of 18 people infected with hepatitis C. She's become an advocate for patients everywhere.
The hospital, really didn't do what they needed to do to keep us safe. Although they had some policies and procedures in place, they weren't enforcing them.
Lauren is sharing her story at this two-day conference. It's made up of folks from the pharmacy field, healthcare, and law enforcement. All agree stealing medication is a major problem that often gets underreported. The conference was put on by the International Health Facility Diversion Association. It was started 8 months ago by John Berkey. He's a former sergeant with the Cincinnati Police Department's Pharmaceutical Division. He said the Queen City averages 50 arrests a year for this type of crime.
We didn't get everybody by any means, but if you take that from across the country, as I have done with the population of the United States and Cincinnati, there should be about 37,500 arrests a year. It's 102 a day.
But the actual number is much, much lower, mainly because hospitals don't report the crime. That's why this meeting is important. Detection and prevention can only help. Megan Mongello, Local 12 News.